So we're going to go over best exercises and non-surgical treatment for an ankle sprain. Now, you're very familiar with ankle sprains. A year ago, what happened to you?
I was out hiking just up in the mountains, Panorama, BC, and wasn't really paying attention to my footing. We were going up a mountain, and ankle kind of went off and fell into a rut, and I got a second-degree tear on the anterior talofibular ligament.
So right on the front here.
Yeah, right on the front there.
Yeah, okay, so... And that is the most common ligament actually. And that was an inversion sprain with your ankle going in like this, right? Which is the most common one to have. It's very seldom that actually people strain the ligaments on the inside, the medial side of the ankle. And that took quite a while for you to get over too. That was a pretty severe one.
Yeah.
And you were in a boot and you were on crutches and that was pretty rough there. So as we go over these techniques here, these are things that when Miki goes over the exercises, she's very familiar with what works and what doesn't work.
Oh, yes.
So let's get into it. So let's first talk about what we need to do when it comes to treatment. It's not just a matter of treating the ankle itself. We have to consider the whole kinetic chain. Now, the stuff I'm going to show you here, it's actually past the stage where you have the boot on. Okay, so the boot's off, you're walking around a little bit, and you're actually able to get in there to a certain degree. But we have to consider the whole kinetic chain from the hip, to the knee, to the foot, because you've got gait imbalances. If you've had a boot on for about 6 weeks, you're going to have atrophy in the calf muscle. There's going to be a lot of things going on here. So, people don't think that, their glutes won't be engaging now since they sprained their ankle, but that's exactly what happens. Okay, so I'm going to get you to lie on your back here, and we'll just say, okay, what are the things that I would consider if we're actually getting on to the ankle and working there? So why don't we get on to the hamstrings here first? You okay?
Yeah.
So let's just say that your left ankle.
Which was my sprained ankle.
Yeah. So I'd get on there. And yeah, you never have tight hamstrings, do you?
Never in my life.
Yeah. So really important that we release these structures for several reasons, because the hamstrings actually cross and they connect into the gastrocnemius with fascial connections. And then I would probably move on to the adductors. The thing about the adductor muscles here is that these are the antagonists of the glutes. So a lot of times the glutes don't engage, they don't fire the way they should, and that has to do with the fact that you're just really tight all the way down the leg. You okay?
Oh yeah.
So when we're working on these, we're going to take our time, work down. It's not tight, is it? No, not at all. All right. Okay. So what I think we need to do here is actually move on to the peroneals. So bring this down. Now, when we think of an ankle sprain, I'll get you to bring the camera over on this side over here, please. Just come right around. So as we were saying, anterior talofibular ligament here. There's usually 3 ligaments that are commonly injured, but the most common one is right in the front. Here is the anterior talofibular ligament. Is there any tenderness there at all?
Yes.
Yeah, still a little bit even to this day.
Even to this day, yeah.
Okay, so now I'm going to get on to the peroneus longus and brevis coming down here, because we have the muscles up here, but the tendons wrap around here. Goes underneath a little bone on the side here called the cuboid, and it acts as a pulley system, and actually it enables you to go into that position. And quite often when these are injured, we start getting a little bit of hypermobility. We could develop scar tissue in that muscle. This will change your gait pattern. So I'm just going to get on that muscle to a certain degree. Okay, take it down. Are you okay there? You a little bit tight? Okay. Tell me if it's too much.
Oh, that's good now.
All right. Just started moving it there, and it was not too happy at first. Okay. And then I'm going to come up to the side here. Good. More on the peroneals now. The first one I was doing was a little bit more tibialis anterior, actually. You okay?
Yeah.
All right. No problem?
No, that's good.
Good. As you see, I'm bringing this kind of into inversion in the same position that it was injured there. Now, when I first start working on this, I'm going to take it pretty easy. I'm not going to get as aggressive as I am with you right at this time. Okay, I'm just going to bring the chair over here, and then I'll just get the camera to come over to this side over here, please. So I'm just going to come and go right in the front of this area here and get where that ligament is. That's pretty tender still?
Yeah. Oh.
Okay, so don't get too aggressive here. Make sure you get good feedback. You okay?
Yeah.
All right. Yeah, it's kind of interesting when you start working on these areas, even though it's been quite a while since, it's close to a year, isn't it, Miki, since you had the injury there?
Yeah.
And you still have some tenderness on here. So we have to consider the long-term effects. If these injuries are not rehabilitated correctly, they actually set you up for long-term chronic injuries, gait imbalances, osteoarthritic changes in the knees, the hips, through the feet. Okay. Now after we work around the ligaments here, I'm going to go actually on the bottom of the foot because you're going to have compensations there. You doing okay there?
Yeah.
Yeah, just great. Wonderful. Thanks for asking. Okay. So as you see, we want to go above and below the point. Miki right now is considering pushing me back with her right leg, but she's a little kick. Yeah, just a little kick. Just a little kick. Okay. So let's just check the mobility here. All right. Check all the joints here. Doing okay there? Let me check the first metatarsal. Really important. Commonly compensations come through here too. When you are pushing off with your foot and you're running, 40% of your body's weight goes through the big toe, so it's really important that this joint is functional. And I'm going to work up subtalar joint, check the navicular here. There we go. It's all good. I'm going to have you turn over face down, please. Okay, so how are we doing there, Miki?
Good.
You doing okay?
Mm-hmm.
So feel a lot more as soon as I start getting some torsion in there, don't you? Just some of the standard procedures. Miki's really happy with me right now. Good, good, good. Doing great. Hanging in there okay? Yep. Maybe. Okay. I want you to come right up on your knees, please. Come right up. So I'm just going to go underneath the gastroc and soleus. Good. So on this particular one, I'll just get you to bring the camera over to here. When you're in this position, the gastroc and soleus just loosen right up. And that allows me to actually get on the other area there. I think we've actually bumped the light over here. Just one sec here. We'll turn that back on. And we'll go across here. There we go. You doing okay?
Yeah.
Tell me the truth?
Yeah.
No, you're not. Okay. Especially when I get on the lateral side here a little bit. Your flexor hallucis longus. Well, that's not happy. Doing okay?
Yeah.
Okay. Okay, stand up and walk around a bit there. Okay. How we doing?
Oh, it feels light.
Yeah, feels a little bit lighter on there. Surprised it was actually as sensitive as it was on that anterior talofibular ligament, but not surprising. It just shows you how these injuries go on and on and on.
How long it can actually take.
Yeah.
Yeah, no, for sure.
So that is a very effective way of releasing some of these structures in conjunction with the exercises that Miki's now going to go over with you.
All right, so now I'm going to be going over with you the exercises and things that actually helped myself. So having experienced this ankle injury, we're coming up on almost a year, I can honestly say now, bit pain-free, still not going to be 100% just because the shoes I wear typically. So these are things that I have used, either prescribed to me by a physiotherapist. Brian was helping me out a lot as well. So these are things that I found helped, and also I've learned a lot from martial arts. So that's also some things that I incorporated into my ankle routine. So after I got my boot off, clearly off, and I was able to kind of have a little bit better of a walking method, what I would start to do is I would actually walk, and then I would put a little bit more balance into my walk on that left foot. So I would try to give a little bit more stability, and I'm trying to re-engage the stabilization of my ankle without setting it into a flare-up and causing pain. So that's what I found helped me kind of just getting the boot off. I would walk a little bit extra slow into that left foot, and I would do that for even 30 seconds my first time. I would work my way up a minute, 2 minutes, 3 minutes, And then when the pain was actually a little bit less and I found I had more stabilization, I would move on to my next set of exercises. So the next set of exercises that I would start incorporating is I would put my foot off of the side of my bed or a block. So side of my bed was the easiest. So the reason we have that is so we can actually have a lot of ankle range of motion. So what I started doing is I would go into flexion of the ankle, extension of the ankle, eversion and inversion, and then circulate. So we're going to go through a little bit of a routine. I'm just going to show you what I did. So what I would do is ankles nice and flat, nice and relaxed, and then I'm going to bring what's called toes to nose. And I'm going to hold and relax. And I'm not going into extension. I just want to hold and then relax the ankle. And I would do this about 10 times. So right now we're on 4. And relax. 5. Relax. 6. Relax. 7. Relax. 8. And it's okay if you don't get to do this as fast as you like. Even if you can get in 5 reps, you're still going to be building up the ankle. So that's number 10. And then next, I would bring the foot up, and then I'm going to go and point my toes down as far as I could. Now this one hurt the first few times. I maybe got 2 to 3 done, and that was it for me because it was starting to cause a little too much pain. If you're noticing that, go within your own pain range of motion. Now again, build yourself up. You want to get to at least 10. So right now we're at 4, 5, 6, 7, 8, 9, and 10. And then next what we're going to do is we're going to bring the ankle inwards. Now this again, watch your pain. Keep within your pain range of motion. So we're going to bring the ankle inwards and then relax. Ankle comes in and relax. In and relax. Again, if you're noticing any pain, just do a couple. Work your way up to 10. 8. Couple more. And last one. And then what I'm going to do is I'm going to go the other direction. So we're going to go in an eversion. Now I found that this one actually didn't hurt as much. This one was actually pretty good, but it's still a smart idea to start using this type of range of motion. 5, 6, 7, 8, 9, last one, 10. And last we're going to be doing circumduction. So that is bringing the ankle full range of motion. You're going to start bringing the ankle inwards, bending it out. So we're going to go 5 in each direction. 2, and you might notice some clicking and cracking. That's perfectly normal. 3, 4, and 5. And then we're going to reverse. We're going to go out first and then bring it in for 1, 2, 3, 4, and 5. All right, so next up, we've done doing our range of motion. Things are starting to feel good. Next thing I'm going to grab is going to be a Theraband. So this, what I'm going to do is I'm going to wrap it. I like it when it's nice and broad. I find it actually works a lot better for myself. I'm going to wrap it around, that way it won't fly off at me. So first ones that I'm going to do is I'm going to pull up on the band and I'm going to point down with my foot. So I'm going to be working the muscles along the posterior side of the leg. So pushing down with the foot, bringing it back up, push down and up. Now I would, starting at 10 reps, and I would work my way up to 20 reps, and I would do this routine 3 times in a day. 4, we'll just go up to 10 today. 5, 6, 7, 8, 9, last one, 10. Next one that I would do is I would push the band down, and you're going to be pointing the toes, you're going to be pulling the toes up towards you. So I want you to hold the band down, and you're going to bring your foot up towards you, toes towards the nose. So this is going to help to strengthen the front part of the leg here. So the tibialis anterior, the front part is going to get nice and strong. So hold it down, and then you're going to bring it toes to nose. So let's do 10 reps. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. All right, next up, we're going to bring the band over to the side, and we're going to do inversion. So for that, you're going to hold on to the band, and you're going to bring the ankle interior. So bring it in towards you. Sorry. Again, it's nice having a nice broad band. There we go. Okay, 10 reps again. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. And then we're going to go on the other side. Bring the band over the top. Same thing, 10 exercises. We're going to be bringing the ankle outwards. Again, if you're noticing too much pain, work within your pain range of motions. Let's get started. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. So lastly, this is the part that I said had a little bit to do with the martial arts that I had learned. When we were doing warm-ups for Muay Thai, we would walk on the interior, exterior, the toes, and the heels to help to build up our ankle strength. So I started incorporating that into my regime for getting my ankle better. So what I would do is find an area nice and long. You can even do it marching in the spot. You're going to go up on your toes, walk on your toes, and I would actually do this for a couple of laps in my basement and just walk around like this. Or if I was getting ready in the morning, I would just kind of stand at my bathroom sink and put a lot of stress onto my ankle. The second one that we would do is you're going to walk on your heels. So you're going to point your toes up and you walk on your heels. Again, a couple laps around, standing in front of your sink. It's going to help to strengthen the front part of the ankle. And then the next one we would do is walk on the outside of our ankles, the outside of our feet. So you're inverting your ankle. Yes, this is going to feel uncomfortable. Now, there's a difference between this feels uncomfortable and this hurts. If it hurts, stop what you're doing. If it's something that you're going, it's kind of stressing out the ligament a little bit, but I'm okay, keep going. Then you're going to invert. You're going to walk on the insides. So I actually do these exercises on a very daily basis to try to help re-stabilize my ankle and get me back to what I was previous to my injury. Yes, it's been a long time for myself, but I also like to wear high heels. That doesn't help, by the way.